Welcome back. You're listening to the Country Viewpoint here on Flow FM, and we are investigating current rental housing standards being a threat to resident health and well-being, some accommodation that certain people are living in, which has been deemed to be unsafe. And joining me on the line to talk more about the research that's been done is Dr. Lyrian Daniel from the University of South Australia. It's great to have you on the line. How are you?
I'm well, thank you so much.
So let's get straight into it. Just give us a bit of background as to what this research is telling us. We're looking at some pre-COVID figures here, which we're estimating have certainly, grown since the COVID pandemic, and obviously we're in a housing crisis at the moment, but really the great concern has to be these unsafe conditions that many Australians are living in right now.
Yeah, absolutely. So, there's a lot of problems within the housing system that we're seeing at the moment, sort of from unaffordability to, precarious housing, evictions, things like that, as well as sort of the actual conditions of the homes themselves. And I guess none of these are really new problems. So in the decades leading up to the pandemic, these problems have been present within the housing sector and within the private rental sector in Australia. But really, pandemic it did two things, I think. Number one is that for many households around Australia, it exacerbated a lot of these problems. So things like, people's perhaps lower incomes, less secure employment, having to be in your home all the time, those problems exacerbated. And then the other thing was that for many of us that don't face these problems, it actually shed a bit more of a light on how widely experienced some of these problems are in Australia. So I guess, now that we're sort of coming out of that really critical stage of the pandemic, we're seeing much more continued discussion about these various problems within Australia and within the media.
So I'm particularly interested in this article that was published in The Conversation. You co-authored it yourself, and it shows that 4 out of 5 Australian homes failed to meet the World Health Organisation's minimum standards for warmth. It's pretty surprising when you're thinking about a first world country here. So just tell us more about what's behind this. Has this got more to do with how homes were built some, 50 to 70 years ago, or exactly what was sort of behind this exactly?
Yeah, that's really interesting research. And to be honest, those figures even surprised us. We knew it was probably going to be a high number, but we didn't realise it was to that extent. So, again, this is a complex issue. So it's things about how we've built our homes in the past. It's also about sort of the maintenance and the retrofitting that we probably don't do to our existing housing stock. And then things like cold housing is also exacerbated by, the means of the people living within the household at a particular time. So with cost of living pressures, previously people might have just been able to put a heater on, and while energy was cheap, that was fine. But with things like, energy prices are skyrocketing, so just being able to flip that switch and put the heater on is becoming sort of less of an option for so many people. So I think that's where the building fabric and the building performance becomes all the more important. So that's a huge issue that we're seeing in Australia as well at this stage.
Would you suggest, Doctor, that one of the major concerns that has to be highlighted is the fact that obviously we're talking about some pre-COVID numbers here where the research shows that there was around 1,000 people living in homes which reflect these kinds of unsafe conditions. You fast forward to where we are now, there's probably people out there who we know for a fact are living in their cars that'd be dying to get into some of these homes, which your research obviously shows are unsafe for people to live in. So that's got to be what the centre of our worries, I guess, at the moment.
Yeah, so this actually speaks to something that's quite a challenge in Australia, and something that we identified in this current policy review as well is that most other countries like Australia actually have annual housing surveys. So they have really comprehensive representative national surveys that give really detailed information about the quality and condition of the housing stock each year. So we can actually then fairly accurately measure the size of the problem, who's affected, to what extent, and then we can formulate appropriate policy responses. So in Australia, the ABS used to do this kind of survey, but they last did it in 1999, can you believe? So aside from work that colleagues and myself are doing in terms of trying to create this kind of research infrastructure, there hasn't really been this national, collection or monitoring of the condition of Australia's housing over the past couple of decades. So when we don't know the extent of the problem and have some really good, solid, reliable evidence around that, it's really hard to then know just the proportion of people who's impacted and how best to help them as well.
How much do you think that number's grown out since COVID, Doctor?
I think that's a really good question, and one that we're unable to answer at this stage, but hopefully it's something with increasing work in this area we're able to put a better number on in the future.
Okay, now tell me more about your learnings from case studies in the United Kingdom and New Zealand. So you've identified these in the paper. Just go through some of these for us.
Yeah, absolutely. So we took a look at, it was mostly sort of to do with the private rental sector. So legislation in terms of minimum standards for properties within the private rental sector. And in both New Zealand and the UK, they've been working on sort of policy action in this area, at least for the last decade, if not longer. So they're sort of much more progressed than we are here in Australia. Some of the things that they do really well is actually within this policy and within the discussion around it is making this really clear link between the housing conditions that we're living in and the kind of health and wellbeing outcomes we may be experiencing. So really closely linking those sort of objectives and outcomes from policy. Another thing that they do really well is sort of create this public awareness around the importance of housing conditions and good housing conditions in supporting our health and wellbeing, and how important that is, particularly for vulnerable members within our communities. So for children and families and older people, just to name a few. And that sort of speaks as well to the social responsibility angle that is present within much of the discussion around these kind of policies. So, for example, in New Zealand, they talk about cold housing as just one thing, and in the sort of promotion of these policies to address cold housing, they talk about the impacts to children's health in terms of asthma or even older members of the community. So there's some of the things. And then on the sort of application front, they make sure that the minimum requirements for properties are really transparent and objective, so everybody knows what they should be, and that's based on research evidence. And then the final one that I touched on earlier is that there's some really robust protocols around actually tracking how things are changing within the private rental sector over time, that things are hopefully improving, and where still needs to be where there still needs to be focus to improve conditions. So having some good protocols around tracking our progress as well.
Well, it's a very relevant space that we're in, obviously, Doctor. So can people look out for any future studies that you've got planned at all in the housing crisis space?
Absolutely. So, I mean, myself as well as many others from the sort of housing research community across Australia are really regularly publishing within this space. And, you know, at this time where we are seeing a lot of media around that, a lot of that is sort of on the basis of sort of academic research as well. So keep a lookout. There's always fantastic things. The other place that people might like to go and have a look is the website of the Australian Housing and Urban Research Institute, who provide a platform for disseminating a lot of this kind of work as well.
Well, Dr. Lyrian Daniel is the UniSA Enterprise Fellow and Associate Professor in Architecture, and it's fantastic work that you've done here, Doctor. We really appreciate your time and look forward to speaking with you again down the line. All the best.
Thank you so much.